Okay, alhamdulillahi rabbil alameen, wa usalli wa usallimu ala al-mab'uthi rahmatan lil alameen, nabiyyina wa habibina Muhammad wa ala alihi wa sahbihi ajma'in. So alhamdulillah, we have with us Dr. Hamza. He, alongside Dr. Tahir, have previously given similar sessions at Wise and Masjid before Ramadan. Obviously, we're in a lockdown situation now, and Dr. Hamza has kindly agreed to give this very important reminder to us online through Zoom. This will also be streamed on YouTube, inshallah. So without further ado, the hand over to Dr. Hamza, and he can take us through his presentation today, inshallah.
Assalamu alaikum, jazakallah khair for the introduction. Bismillah ar-Rahman ar-Rahim. So, first of all, assalamu alaikum to everyone, and Ramadan Mubarak. Inshallah, I've just been asked to prepare a small talk, 20 minutes, maybe a little bit longer, just going through some of the health implications of Ramadan fasting from a medical point of view, keeping in mind the current situation with the lockdown and the COVID situation, and then focusing a little bit about general principles of how to keep healthy, how to keep yourself well, both mentally, physically, during Ramadan, and also a little bit of medical sort of advice. Just to pre-warn you, I am a doctor. I'm a local doctor working in High Wycombe, but if there's any medical specific advice that you want, then not to take it from this presentation, but to seek medical help, speak to your GPs. If there's any specific Islamic fiqh questions about should I fast, should I not fast, then consult a medical doctor and consult an imam or someone who you know and who you trust and who's trained Islamically for that opinion to give you that fatwa. So that disclaimer, inshallah, we'll start. So bismillah. So first thing, why do we fast? And obviously we know Islamically fasting is compulsory for us. Allah says, oh, you believe fasting is prescribed for you as it was prescribed for those before you, so that you may become righteous. And this is the main purpose that we fast for Allah subhanahu wa ta'ala. The health benefits, and yes, there are health benefits, are secondary, and I'll talk about some of them. But the main reason we fast is for Allah subhanahu wa ta'ala. And the other fast as well that we fast throughout the year. Ramadan is not the only time of the year where we fast. There's sunnah fast that the Prophet ﷺ used to observe, like the 13th, 14th, 15th of the Islamic months, the Mondays and Thursdays, etc. So what are some of the health benefits of fasting? Fasting can cause weight loss. It can cause, and that's a big thing there, is if it's done properly, it can cause, it can help with cholesterol levels, it can help lower your cholesterol levels, it can help with your cardiovascular health, and that will prevent things like strokes and heart attacks and things like that in the future. It can help with your sugar control. It can help with your mental well-being. And actually a really important one, which we don't think about, is it can help with habits and addictions like smoking, and people who are addicted to sort of binge eating. It can help to contain that, and it can help to control that. And it can boost immunity, and something which with the coronavirus epidemic going on, it's important to keep yourself, to have a strong immunity. In the scientific literature, they call this intermittent fasting, and there's been evidence, there's been studies to show that intermittent fasting, where you fast for a period of time, helps improve all of these things that I've mentioned. So this is scientific evidence to show that fasting is healthy for you and beneficial. And this is just a quick breakdown how it works. So the first 8 hours or so, you go into the fast. And the body starts to use your glucose, which is in the muscles and in the liver. Initially, it starts to use the glucose. And then towards the end of the fast is when the body starts breaking down fat, and it starts using fat to break as energy. And that's where most of the weight loss comes. So that's more towards the end of the fast. But the key thing here is sort of in the middle of the fast. That's the bit when your sugar levels start to drop, and then your fat levels, your body starts to use fat. So that's when you're most at risk of having low blood glucose, and that's important for diabetics, which we'll talk about now. So what are some of the risks of fasting? Dehydration, obviously that's very obvious from the lack of water. Stress, sleep deprivation, more so when if you're working and if you've got to wake up early, not so much these days because most people are working from home. Worsening of any medical conditions. So if you're diabetic, if you have heart problems, lung problems, kidney problems, it can make it worse. So we'll talk about some of the high risk groups, but if you or your parents or grandparents or your family do fall into these high risk groups, then please speak to your GP or your doctor to get some advice about them. So things like diabetes, and especially diabetics who take insulin. So that can be type 1 diabetics or type 2 diabetics who have then needed to go on insulin. If you have severe asthma or COPD, COPD is a lung condition from chronic smoking usually, chronic heart disease, chronic kidney disease, mental issues where you have to take your medications at regular intervals, glaucoma, infections, and obviously the infection in there includes the coronavirus infection. If you're having symptoms of it and if you think it could be severe, then the important thing is with the coronavirus, you can deteriorate quickly. So medically, just be very, very careful in terms of fasting. If it's a very mild infection and if you think you can do okay with it, then fine. But if it's impacting your breathing, if it's causing you to become very short of breath, just doing minimal activities like walking up a flight of stairs, then I would be very careful with fasting and pregnancy and breastfeeding as well. And the reason why we say this is because Allah gives us in the Sharia, He gives us he allows us to be exempt for medical reasons. So if you are unwell from the coronavirus or from any of the other issues, then you can miss the fast and make the fast up at a later date. That's if you're young and fit and healthy. If you're old and you can't fast because of whatever condition and you can't make up the fast at a later date, then you can give a fidya, which is compensation. So there are things within the Islamic religion which allows us to fast at a later date. Okay, so that's the sort of nitty-gritty, and now we'll talk a bit about how to eat healthy, how to maintain a healthy, balanced diet, how to keep well during Ramadan. So how to eat healthy. So suhoor, we're talking about suhoor, so we want to have a wholesome, non-processed, balanced diet. Key thing here is having a moderate size, having a size that will fill you up, but not something that you'll be overeating and you'll have discomfort and you'll have indigestion and reflux. Having fiber-rich foods and having foods that are slowly digesting. And it's called lower GI food, so glycemic index, and that means foods that release sugar slowly and constantly and consistently throughout the day, rather than giving you one spike of sugar all at once and then nothing else. And that's things like oat, Weetabix, muesli, wholemeal bread, rather than white bread. Drink lots of plenty of fluid, plenty of water. That will help with your hydration. Avoid sugary drinks because the sugar in them will just cause you body to excrete them in the urine. Avoid fizzy drinks, sugary drinks, caffeinated drinks. Again, caffeine is a diuretic. It makes you go to the toilet, and because of that, you'll lose lots of fluid. Both avoid caffeine at iftar and suhoor. You can have decaf tea. Decaf tea is a very good alternative to normal tea, and you can barely taste the difference. Have suhoor as late as possible, and that's obviously one of the sunnahs as well. Okay, and these are some of the fruits that we're talking about. The foods and fruits that we're talking about: high fiber and complex carbs, and carbs that have low glycemic index, meaning they release sugar slowly throughout the day. And for iftar, simple things like avoiding deep fried foods, avoiding things like samosas and things that we like to eat can cause heartburn, can cause indigestion. Having grilled food, baked food, steamed food, or air fried food. So instead of deep frying your samosas, you can air fry them. Having fruits and vegetables as snacks. Again, avoiding sugary, fizzy, and caffeine drinks. They will make you thirsty, and then they will make your body lose water and excrete water. And then you're just chasing after yourself. You're constantly trying to rehydrate yourself and losing more fluid. Coffee drinkers, it's a bit too late now to do this, but you can sort of slowly reduce the amount of coffee that you take every day, so that you're not all of a sudden having caffeine withdrawal on the first day of Ramadan. A lot of people get headaches and difficulty concentrating because they're having a caffeine withdrawal, and that will probably be for the first couple of days of Ramadan, and then after a while your body adapts, your body gets used to it. Okay, and the key thing is, I think all of this is obvious. All of this is pointless if we don't do it in moderation. I think that's something that people, especially in our cultures where we have a culture of excessiveness, we tend to forget moderation. Moderation is the key. You can eat as healthy as you want, but if you're having too much of it, then you're causing problems for yourself. The next step in keeping being healthy and sort of being healthy and being well in Ramadan is physical exercise. I think physical exercise is something that we don't often think about. So for generally people under sort of 60, under 65 with no other health problems, then gentle physical activity is perfectly fine and actually is encouraged. If you're slightly older, if you have health conditions like lung conditions, heart problems, or diabetes, then you can just be very, very careful and very cautious. Generally, if you're young, fit and healthy, then physical exercise is perfectly fine. Avoid long runs. Avoid things like when you're running in places where, far away, where if anything were to happen, there's no one around, for example. Avoid things like heavy lifting, because if you're dehydrated and you're putting that pressure onto your body, then you can risk passing out. And avoid rigorous exercise, because you want to avoid dehydration. And like I say, at the moment with the coronavirus pandemic going on, we want to avoid going into hospital. If you have a physical injury or if you overexert yourself and you end up ending in hospital, then you're very high risk of catching the coronavirus. So you're not really helping yourself. You're back to square one. A good time for exercising is after Taraweeh. So you have your iftar, you have your prayer Taraweeh, prayer Isha, everything, and then before your suhoor, and it's a good time because a lot of people aren't commuting or going out to work. They're working from home if they're working, so they can wake up a little bit later. So you can stay up in the night before Sahri, and even if it's a small 15-20 minute exercise, then that's absolutely fine. All the other alternative is before iftar, so around Asr time is a good time to take a walk. And remember, I said that's the time when your body is burning the fat, and it's burning the fat stores. Watch out for dehydration. Symptoms of dehydration is you feel very, very thirsty, very dry mouth. Urine becomes really dark in color. Hypoglycemia, if you're diabetic, if you're exercising, then watch out for low blood sugars. You can start shaking, sweating, you can start having blurred vision, you'll feel very, very hungry, and heat stroke as well. I think that's another thing if you're exercising, and especially in Ramadan with the weather getting warmer as well, watch out for things like heat stroke. And then the final thing that we just wanted to quickly touch on was mental well-being. So I think this is one that we sort of a lot of the times forget, and it's even more important now with the coronavirus situation. Fasting in Ramadan will physically make you hungry, and not having much to do in terms of going out, going to work, or doing your daily activities that you're normally doing, you won't be able to do, and that the boredom sets in. And those together can cause your mood to go low, can cause mood swings. But just remember, this is normal. There's nothing wrong with being a little bit low in mood, or not feeling as high and as energetic as you normally would be. That is absolutely normal, and that's something that probably will happen. So just get over it, expect it, and it will happen, and you'll get through it. And inshallah, we'll get through it. But if you do have any serious medical illnesses or conditions, if your depression is severe, if it's prolonged, or if you're having self-harming thoughts, things like that, then please do get medical help. We don't want your Ramadan and the whole coronavirus situation to be impacting your mental health in an adverse way, and speak to your GP if that is the case. Speak to your doctor. They can try and do something about that. And look after your mind as well as your body. So we talked about healthy eating, we talked about the exercising, but it's not just your body, it's your mind as well, which is important to look after. Obviously fasting and the Ramadan, your iman will be high and you'll be doing lots of ibadah and seeking refuge in Allah. That's one way to look after your mind and keep it active. But just go for walks, clear your mind. Again, exercise really helps. Exercise releases endorphins, which are chemicals which make you feel happy and positive and energetic. Even if you're starving and hungry, still do it and reconnect. I think this coronavirus situation, yes, it has caused lots of massive issues and lots of problems to our societies, but in some ways there's blessings to be learned from it, in the sense that we're all at home, all the families together every day. We've now got time. How often was it beforehand we were saying, oh, I don't have time to read this book, or I don't have time to focus on my salahs, or I don't have time to do X, Y, Z. Now we've got all the time in the world. We've got no excuses. Everything is put on there right in front of us. And the last sort of point, which I don't have the statistics, but I've been reading that domestic abuse rates have been increasing during the lockdown, and not so much in the Muslim community, but across the UK, the amount of alcohol that's being sold is increasing. And domestic abuse is a big problem we don't talk about in our Asian and Muslim communities. But if all of this, with all of the coronavirus situation and the Ramadan situation, please get help. If this is a problem for you, speak up and get help from your community and from the health providers that are there to help you. So inshallah, that's the main parts. That's the main parts of the talk. So the summary really is mind, body, and soul. Keep your mind well. Look after yourself. Keep your mind clear. Keep yourself going. Keep yourself in a positive mind frame. Keep your body physically well, physically healthy. Keep your diet clean and healthy to help you get your energy and to help you focus on your ibadah. And mind, body, and soul. And finally, obviously, the main purpose, the whole point of Ramadan, is to reconnect with the religion, reconnect with Allah subhanahu wa ta'ala, and having a healthy Ramadan, having a physically healthy Ramadan only allows us to do this. So inshallah, that's I think that's most of what I wanted to say. So Rafi, inshallah, if you want to do questions on this, you can do.
Yeah, exactly.
Otherwise we can wrap up.
If you're taking the time out to present to us. If there's any questions, there's a chat on Zoom. You can just ask questions in the chat and I can read them out. And also, I believe on the live stream, there's an option to ask questions.
Hold on, let's have a look.
There's questions about when's the next WISE module, etc. These will all be announced. The WISE events will be announced in due time. But for now, if we can just stick to questions related to the topic itself. I'll give you a couple of minutes. If you don't have any questions, then we can just stop there, inshallah. Okay, there doesn't seem to be anything. Okay, so Jazakallah khair to everybody for attending, and also to Brother Hamza for taking the time out to present. Subhanaka wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.
Assalamu alaikum. Jazakallah.
Wa rahmatullahi wa barakatuh.